Right, 9 minutes past the top of the hour. Karibu sana. This is Morning Cafe. Happy to have you this particular morning. Sijiko kwa nyumba, umerelax kwa sofa pale, weka remote chini because it's about to be a very interesting conversation. Atakamu uko kwa job, ambia boss, let's listen to TV47 this morning because we're talking about your body. Two parts of your body that are very, very critical, your kidneys, or if you have one, your kidney. According to the Kenya Renal Association, it says that over 4 million people in Kenya have kidney diseases. Are you one of them? Do you know who's someone who is part of them? A question of the day for you is, how do you take care of your kidneys? It seems like a very, very tough question, but then it's also very easy. We have a clinical officer all there from Maya Health Specialists. She's not a new face to this particular table, but then for some of you, she might be. Joy Magana, karibu sana.
Thank you so much. Lovely to be here again.
Yes. You could do a more intro of who you are, father. Okay. You could also include any social media handles as well, before now we get into a conversation of the day today.
Okay, so my name is Joy Magana from Maya Kidney and Health Specialties Hospital. I am a clinician there. You can find me on LinkedIn at Joy Magana or Instagram at Joy Magana, Joy Wanjiru, sorry. Yeah, so today we'll be discussing kidney as a whole and the diseases that encompasses around the kidney.
All right. And the fact that we even have some of this, the parts here, that tells you that we're going to be critically analyzing your kidney. Venye hiko tunaangalia each and every single part of it and its functions as well as the diseases. Question of the day for you, how do you take care of your kidneys? So far, Gor Kimani anasema fasting occasionally, 1 meal a day, wheat and sugar, free diets, i.e. no sodas. Uyako sawa?
Yeah, he's trying. He's doing good.
He's trying. Hajafika the peak.
No, hajafika hapo.
All right. Tuone back at home wherever you are. 22047 is our SMS number. 0793-267-279 is our WhatsApp number. How do you take care of your kidneys? Tutafurahia sana kusikia sauti yako this morning. Call us live. 0795-045-864. When you call us live, by the way, do this. Tell us your name, where you're calling us from, and then mute the sound of your TV or your gadgets, and or just probably have it off and then ask Magana all those questions you have. So real fast, let's start with the anatomy of this kidney. We have it here. Before even as you get into the parts, what is a kidney really?
Okay, so kidneys are a bean-shaped organ in the abdominal area and we have two kidneys. So the main function is to filter waste products from the body. So ideally, we each have two kidneys, but you'll find that some people are born with one kidney and they are functioning very well.
Okay.
And that is very possible because even these two kidneys don't operate at the same capacity, both of them.
Is it genetic? Sorry to cut you short briefly. Is it genetic when you'd find someone born with just one kidney?
Yes.
Okay. Right.
Well, not genetic. Not genetic. It's congenital, rather. Yeah.
What's the difference?
Genetic is something that's passed down from family, but congenital is something it's an anomaly that you're born with.
Okay.
It doesn't necessarily have to be predisposed because of the family condition.
Oh, right. Right, carry on. So the parts?
So we have the renal artery, which brings blood from the body, from the heart to the kidneys, where it's filtered in the medulla. In the medulla we have a million units called nephrons. So these are the ones that carry out the filtration process.
I always thought medulla is only the brain, the medulla oblongata.
Yeah, I can imagine, but not really. So you can imagine this medulla, each kidney has a million of the nephrons.
Okay.
So the body is a pretty interesting thing. So after it's filtered, it goes out through the renal vein where the now clean blood goes into the body now. So I will go briefly into the functions of the kidney.
Okay.
So we stated that its main function is to filter waste. In this waste is urea, which is a byproduct from the proteins, and creatinine, a byproduct of muscle breakdown. And toxins that are coming from drugs or alcohol intake and all that. So it also carries out hormone secretions such as erythropoietin, which is important in production of red blood cells. We also have, there's an organ on top of the kidney called adrenal gland, which produces glucocorticoid hormones. We also have renin, which is important in blood pressure regulation. And it's a vital organ in the production of glucose. In the body, liver takes up 70% of that role, but the kidneys also do 20% of glucose production. It's also important in bone metabolism because it produces a hormone called calcitriol, which is a form of vitamin D that allows the body to be able to absorb calcium in the small intestines. Yeah.
Right. One would wonder why someone needs two kidneys, and I know this is a question you've gotten a number of times, because mtu atasema ama niuze kidney yangu, you know, there's always that street lingo of the same. At the end of the day, why does the body really need two and not the one? Because you've told us that for those who are born with one kidney, the body will still function the same. So why do you really need two?
And so like I said earlier, not both of them don't operate at the same capacity.
Okay.
So even in the long run, you might be predisposed to things like diabetes or hypertension in the family. So you'll find that the kidney that is not operating at full capacity will be overwhelmed with those diseases. So your body will lean towards the more healthier kidney, so to say. And so generally, yes, you need that balance from the two kidneys.
Right. Any other bit on the functions now as we get into the diseases? So we're starting off with the whole parts as well as the functions, so that you also understand how, even as we now get into the diseases, the kind of questions that you're going to be throwing in, at least to go in a background here, this is what we're getting into. So for the functions, any more to add?
Not really.
Right.
Those are the major ones.
The major functions of the kidneys.
Yeah.
So now for the diseases, are they a lot? How many? What are the major kind of kidney diseases, even in the country, that we really need to be aware of?
Okay. So now, because our chronic diseases are a challenge in the country, we have a lot of cases of diabetes and hypertension, and all these can result to kidney failure. So we have diabetic nephropathy and hypertensive nephropathy, where if you have uncontrolled hypertension or diabetes, they might end up damaging the capillaries of the kidneys, which can further damage the kidney because you're not getting enough blood flow into the kidneys. So it's not operating at full capacity. We also have kidney infections called pyelonephritis. So these are fairly common, especially in women, because the urethra, you know, the kidney is part of the genitourinary system. So the urethra, especially in females, are shorter as compared to men. So it's easier for the infection to travel upwards towards the kidneys. And many people just assume it and treat it as a UTI. So it ends up being a really big issue when it goes to the kidneys. So there's also, apart from that, I think it's best I classify this into acute and kidney and the chronic.
And then the
kidney
chronic,
failure.
right.
Yes.
And even as you also do that, what's the difference between the acute as well as the chronic?
Okay, so in the acute, it's a sudden damage, not damage, it's a sudden reduction of kidney function. So this can be, we classify it into three. So we have pre-renal causes, which means that there are causes affecting other organs that are related to the kidney, like cardiac, heart problems, liver problems, or even infection, systematic infections that can lead to shock, septic shock. And majorly, we also have, why is it running away from me? Volume depletion, yes. In terms of dehydration, like if someone has persistent vomiting or diarrhea, or losing blood through accidents or burns and all that. So those are the pre-renal causes of the acute kidney. Then we have the renal causes in themselves, which are now in the kidneys.
In the kidney itself,
So you could have interstitial nephritis, which is an inflammation within the kidney. So when you have this inflammation, it damages the blood vessels and the capacity of the kidneys to do the filtration. You could also have tumors inside the kidney.
Right. And so let's start with the inflammation bit of it. In layman's term, what does inflammation mean? And could you be walking around and there's kidney inflammation, and so what kind of signs are you going to be showing so that your body even tells you there's kidney inflammation before you get to the tumor?
Okay, so inflammation is basically just like swelling up of the capillaries and vessels inside the kidneys. And it is very actually possible for it to go unnoticed for a couple of years.
Right.
So you could just start having symptoms like an year after the damage starts. And you could have symptoms like reduction in urine, or peeing a lot at night, or swelling up because now you have fluid overload that the kidneys cannot remove. You could also have abdominal pain because of the accumulation of toxins in the blood, or confusion, itching. They're not really specifics. They could be, everywhere. But the most common is the reduction in urine, because this is the filtration system of the body. So if you see any reduction in your urine, or any cloud-like urine, if it's frothy, like soapy or so, or any blood in urine, that could be a telltale sign of kidney damage.
Right. Yeah. So you'd also mentioned about the kidney tumors?
Yes, kidney tumors. The most common one is renal cell carcinoma. Not really, I wouldn't say it's common compared to the other types of cancers, but it is also a cause that could cause the renal kidney failure. Right. Intrinsic.
Right.
So you could also develop blood clots within the kidneys that could go easily unnoticed, or have renal stones inside the kidneys.
Right. Is there an age factor here? A certain age that people might be more prone to getting some of these kidney diseases?
Yeah. So mostly above 40. 35, above 35, 40, around there, you could start getting the signs of kidney damage.
Right. So one would wonder that, is it a certain lifestyle that they have been living that would now lead them to getting these kidney diseases? Mtu amefika hiyo 40 and they're like, of the past 20 years, this is how I've been living my life, or some things that I've been doing that led to this. Could you tell us about that?
Yeah, so in terms of lifestyle, not drinking a lot of water is actually it sounds basic, but it's very vital, because it helps the kidneys remove those waste products. And you could also develop kidney stones, and this arises from red meat or seafoods that could, in accumulation, cause the kidney stones to form. Also, in terms of toxins, when you are self-medicating, you don't really know what you're doing to your body. So, and most of these drugs are metabolized by the kidneys. So everything that goes through there is burdening to the kidneys if you don't really need it in your system. So this is also a factor. And most people don't really, how do I say this? They don't take their health seriously. So you could just find someone, you know, akotura hazake, they don't really know what they're doing, and this is really detrimental to their health.
All right. I'm going to have a caller right now. Kindly tell us your name, where you're calling us from, and I hope umezima TV.
Hello.
Dennis from Ruiru. Habari asubuhi.
Nzuri sana. Hello.
Hello Dennis from Ruiru. Nick tusaidie na sauti hapa.
Okay,
Yes, habari asubuhi. Uko na swali au ni maoni? Yes. Okay, tafadhali kabla uendelee Dennis, weka your phone mbali na your mouth ndio tukusikie vizuri. It's muffled.
Okay, Emma. What are the signs of kidney?
Kindly repeat that again.
Signs of kidney stones.
Signs of kidney stones.
Yeah.
All right. Ni hiyo tu ama you have more?
It's only that.
That one for now. Okay, thank you. Thank you Dennis kutoka Ruiru. Signs of kidney stones. Joy.
Okay. So one of the remarkable sign of kidney stones is pain. Excruciating pain in your lower back or pelvic area. You could also see blood in urine, which is because the stones are trying to really pass through the ureter, which they could graze the lining of the ureter. You could also it could also cause infections. So you could have fever or chills, nausea and vomiting, and especially you could also have upper abdominal pain as well as a result of that.
Right. The cause of the kidney stone?
Lifestyle.
Oh,
most of this
goes back to what we were talking about earlier.
Yes,
Okay.
to meat. Most of these stones are caused by some salts that are in the meat, especially oxalate and struvite. They are caused by breakdown of the proteins that you get from the meat. And if the kidney isn't at full capacity, it doesn't really remove these toxins as well as normal functioning kidney. So this accumulation of the stones could form crystals in the kidney, which now leads to kidney stones, and you could have a large enough kidney to fill up, a large enough stone that could fill up the entire kidney.
Wow, right.
Yeah.
And when you talk about meat, it's a very touchy subject for most people because everyone has their their perception. Some would tell you hapana, lakini mbona mababu zetu walikuwa unakula nyama ikiwa hivi and they never got some of these diseases. Is there, from a medical point of view, is there a certain way how we should be preparing the meat and even seasoning it and all that?
Not really. So red meat has a high content of purine. This purine produces uric acid in the body when it's during the intake. So it's not really about preparation or anything of the sort. It's just optimizing white meat over red meat because it has a lower content of purine. And I know it's pricey as compared to red meat, so it's just some few adjustments here and there. You could like take it twice a week or so to reduce the purine intake in the body.
Right. Yeah. And still on the whole bit of lifestyle, because earlier on you told us that some of these diseases, the age, mtu akishafika akianza kukaribia 40s, that's why they might be more prone to.
Yes.
Does it mean that, so before that, when do you start to go for the screening? Is it at that ukikaribia 40 or even in your early 20s, your teenhood?
Now, there are two parts of this. If you have a family history of diabetes or hypertension, it's advisable from the age of 28, you could start doing these annual checkups of the kidney function test to see, to just range how your kidney is functioning. Because we use something called the GFR, which is a glomerular filtration rate, which is how we use to see how how well the kidneys are filtering
Okay.
The optimum is 90. So we use that to gauge how well your kidney is functioning. And if you do this from the age of 28, if you have a family history of that, it could be, help us keep track of how well your kidney is functioning.
All right. Victor, you have a caller right now. The name and location?
Yeah, good morning.
Yes, Elvis, habari asubuhi.
Unaongea na Elvis.
Uko na swali au ni maoni?
Yangu ni swali.
Yes, uliza.
Yeah, we currently live in the era of social media.
Yes.
And you see a lot of people recommending about detox. Yeah, you find some people talking about maybe some concoctions, maybe ginger, whatever. Some other people, you'll find them recommending about the green tea. Will that be a solution to maybe reducing these kidney diseases or such damage?
Right.
Yeah.
Thank you for that. It's a very good question from Elvis. You've definitely seen this, Joy.
I have.
Is this the remedy to go ama watu hizi ni stories za jaba tu?
So I actually I know this is a very touchy subject, but most of these herbal medications, they're not really, they have antioxidant properties, which are very essential in the human body, but at the same time, they don't have, they're not manufactured well. As much as these drugs are manufactured in factories and they derivatives of plants, they remove the unwanted properties so that you can only have the therapeutic properties in these medications. So when you self-medicate with these herbal medicines, you're also introducing the harmful aspects of them. And most of these herbal medicines are damaging to the liver. And when you have this liver damage, they go hand in hand with the kidney diseases. So we don't really encourage the herbal medications as much because you don't filter out the unwanted properties of them. And most of them are metabolized by the liver, which is very touchy. Yes.
All right. So some would ask, now that you're telling us, we don't really rely on some of this, the green tea, some of these concoctions, which is a detox. But what are some of those things, meals, fruits that you can rely on that are really readily available? Ukitoka tu kwa nyumba unaweza pata hapo kwa mama mboga, and you mix them, probably blend them, and they help you in this lifestyle topic.
Okay, so fruits as a whole, they're very good in increasing water intake in the body, which clears out the kidney system. But at the same time, we should also avoid foods that are extremely rich in potassium because we don't want to overwork the kidneys. And some of these fruits are bananas and papaya. So those contain a lot of potassium content that we don't want in the system.
Right.
Then obviously optimizing white meat, like I said earlier. Taking a lot of water as well. Avoiding a lot of starch because this could cause a build-up of plaque in these arteries and veins and the capillaries in the medulla, which damages the filtration capacity. Exercising because it reduces the cholesterol levels in the system. Yes, that's basically it. And I know avoiding is a strong word, but limiting alcohol intake.
I was heading there. Because I know it's one of those burning questions that a number of people would really want to know for the alcohol consumption. As you rightfully put it, avoiding kabisa might be a touchy bit for many people.
Yes.
But then now, how do you balance, even after or before the consumption of the same, or even after the do's and don'ts of the same?
So first, people usually wonder why alcohol, why medics say to avoid alcohol. And they don't really know that alcohol is a lot of starch. It is a lot of starch. It comes from barley and vodka from potatoes, which is starch. So the do's and don'ts. Well, you could limit it to special occasions and making sure that you have eaten a rather not hefty but sustainable amount of food before, and during you could make sure you take in a lot of water to help wash it out.
Right. We have another call, I believe. Could you tell us your name, your location, and I hope umezima the audio. Hello, Kariuki. Halo, habari ya asubuhi?
Niko salama.
Asante sana kwa kutupigia hii asubuhi. Ni swali au ni maoni?
Mimi niko na swali.
Uliza tafadhali, Kariuki.
Niko na swali.
Uliza.
Niko salama.
Zima audio ya TV tafadhali.
Niko na swali.
Uliza Kariuki.
Nilikuwa nauliza daktari.
Umepotea.
Mimi nauliza.
Yes.
Kupata makojo iko na pofu. Na makojo bila pofu. Nauliza kupata makojo iko pofu. Na ambaye haina. Kuna dalili ya ugonjwa.
Unaweza Kariuki tafadhali rudia swali. Okay. Alright. Sawa. Asante sana Kariuki, nimepata swali yako. Magana, Kariuki is asking the urine iko na povu venye ulikuwa umesema the cloudy kind of urine.
Yeah.
Is it a sign? Is what he's asking.
Yes, it's a sign. So having cloudy urine indicates that there's a lot of proteins in your urine, which is not supposed to be there because it's supposed to be reabsorbed by the kidneys into the bloodstream. So that indicates that there's some damages in the nephrons of the medulla that is causing the leakage into the urine. So that could be a sign, and I will encourage him to have a test, kidney function test and urinalysis, to just rule out any kidney damages. Yeah.
And that goes to the question I had asked earlier about the screening. If you really have to wait until you're in your 40s, or you can just do it before, kindly tell us the kind of details that I need to know.
Okay.
Even before I go to this screening. I'm being told we have a caller. Tabitha from Kitale. Habari asubuhi Tabitha.
Mzuri sana.
Asante sana kwa kutupigia. I hope umezima audio ya TV ndio tusikizane vizuri.
Nimetoka kwa hiyo different room.
Yes, endelea.
So Kitale. And my husband was done kidney transplant 8 years ago.
Okay.
And we are doing well. We cannot have a complaint. But my concern is this post-kidney transplant treatment.
Okay.
I don't know what can be done because at times, many people are not getting money to buy the drug. So we have that challenge for sure. A big challenge. Like one of the drugs called cyclosporine.
Called what?
Cyclosporine.
Okay.
Is 500 shillings per drug, and you are supposed to take one in the morning and one in the evening.
Okay.
So I really don't know what can be done because most patients are dying because of lack of blood. And yet, the NHS had given us some token when we were doing transplant. The one that we really appreciated. So I feel something to be done to enable these people to get treatment.
All right.
Otherwise, we had a kidney transplant, which was very successful in Kenyatta,
All right.
and we are doing well. But we have that type of medication.
Okay.
Yeah.
All right. Thank you for that feedback, Tabitha, as well as even the question from Kitale. Salimia sana watu wa Kitale, Joe, and she's getting into what I wanted to now get into, the management bit of this, the transplant, the dialysis a little bit later on. So even before you get into this, talk about the screening, what someone needs to know as they are getting into this, and now we get into Tabitha's concern.
Okay. So like I said earlier, for people who have the predisposing factors, you could start earlier, maybe 25, 28, to have annual checkups of the kidney function tests. Then any other person could start at the age of 30, because this is when now things start declining, so to say, in the body functions. So you could, from the age of 30, you could start doing annual kidney function tests and urinalysis just to rule out anything. So that, then in also for the screening, apart from those two, you could do full hemogram to see if there's any infections, and liver function test as well. So these four are very vital in terms of screening. Yes.
Right. Before we get into Tabitha's question, we have another caller from Machakos. Habari asubuhi, who are you talking to?
No.
Hello, Terminus.
Hello.
Hello, habari asubuhi, Terminus.
Niko salamu.
Asante sana kwa kutupigia. Uko na swali au ni maoni?
Yeah, I wanted to pose a question in relation to Tabitha's question.
Yes.
When a donor donates a kidney, is it a must that he takes a medication for the rest of his life?
Okay. When okay, just to reiterate kitu umeuliza ndio our guest asikie vizuri. When the donor akidonate, is it a must achukue dawa?
Yeah, is it a must dawa after the donation?
Okay. All right. Thank you for that, Terminus. All right. So a number of questions on your way. We could start with Tabitha's, because Terminus's question is related to Tabitha. Tulianza ni Tabitha. Just to reiterate again, if you're just joining us, telling us about the husband who alikuwa na transplant some years back, and now her biggest concern is the cost of treatment, telling us that there's a particular drug that the husband is supposed to use, 500 shillings per drug, and it is supposed to be taken one in the morning, one in the evening. This is really costly for them.
Yes, it is, and it's very unfortunate how medicine is very expensive in Kenya right now. But I think there's works in the process to alleviate this burden for patients and the people taking care of them. I think in the new SHA, most of these medications will be covered so you won't have to buy them out of pocket.
Right.
Yeah.
And just to reiterate what you're saying, remember the former Cabinet Secretary of Health, Susan Akumicha, during the World Kidney Day, I think it was the 14th of March, saying in a quote, to handle the late stages of kidney disease, the ministry, through the Social Health Insurance Fund, will extend frequency of maintenance for hemodialysis from the current twice a week to the standard thrice a week. And this, she continued talking about even the price of this particular medicines. But then even her biggest concern is what can be done really. Do you feel like on ground people are aware of alternatives and the cost and even the management really?
Alternatives in terms of?
generally, what you're telling us, if you can't, the management, the lifestyle bit of it. Yeah.
So preventive measures.
Yeah.
No, I don't think so. And even if they do, they don't implement it in their lives. Then most of these people don't even have insurance. Most of Kenyans, especially the young people, they don't optimize insurances in their lives. So you will get, even people are diagnosed, emergency cases, they need dialysis, they don't have insurance. So I would really advise people to start working on the insurances, especially if they're not registered, they could register in SHA because it's easier as compared to us transitioning to SHA. So that is very vital, because hemodialysis is expensive if it comes out of pocket. And you also have these other medications on top that you have to get on a weekly basis.
Yes.
So insurance is really important in chronic disease management. And like I said earlier, I think SHA is extending the leeway in this chronic management. So you could, even in this immunotherapy medications post-transplant, they could be covered in the SHA. And I am truly sorry that they have to buy it out of pocket. It's really expensive.
Yes. And speak of the same, the medicines, a question that Terminus, a caller from Machakos, had asked, if someone donates the kidney, are they supposed to take any medication?
No, because like I said earlier, not all of them function at the same capacity. And you, as a donor, you don't have any risk of getting any immunosuppression or any, because even as a donor, you are assessed to see if you're capable of donating that one kidney. So you don't have anything that is limiting your health or suppressing it in any way. So you don't have to take it. And these post-transplant medications are to prevent transplant rejection. And you have to understand that these patients are already immunocompromised. So these medications are to reduce the threat of getting a transplant rejection, because their system is already immunocompromised. Yes.
And speaking of transplant, this is something that I want to pick your mind on. Posthumous transplant. In a nutshell, in case you're hearing this for the first time, and you'd help us elaborate on it further, that after someone is deceased, after they passed away, getting the kidney and transplanting it to someone who really needs it. It is one touchy subject in our culture, even as a country. From the medical point of view, what are your thoughts on this? Do you think this is somewhat the silver bullet that we really need? Because looking at the numbers, Kenya Renal Association tells us that by 2030 the numbers might increase for those who have kidney diseases. Is this the silver bullet we really need?
It is, and the main challenge in that is changing people's minds towards it, because getting an organ from a cadaver it can be mentally, challenging.
Yes.
But it is, and there's also this idea of it not working, like rejection happening sooner. But I will use one of our patients as an example, who had 2 transplants actually. One failed, which was from a relative. So, but he got a posthumous transplant, and that lasted him 10 years, as compared to the one he got from the relative, which lasted 1 year. So it's just about mindset, changing your mindset towards it. It could be the saving grace that we all need. And seeing as dialysis is not sustainable, it's just there to like kukuskuma until you find a suitable donor. Changing the mindset towards the getting organs from dead bodies is it could be the saving grace.
It is something that the government is really even pushing and urging people to go for the posthumous transplant. But just taking a look at some of the comments that we have here, still related to that. Kevin Lina Sema, I want to sell one. We'll get to that and the whole bit of selling and donating. Being told you have a caller. Can you tell us your name and location? Tabitha from Kitale.
Yes.
Karibu tena. Ni swali tena mani. Yes.
My issue is that I have a kidney post-transplant.
Okay.
And my issue is we have NHIS, we have insurance.
Mm-hmm.
We would kindly request the insurance company,
Right.
when they are sharing money, to consider this post-transplant patients.
Mm-hmm.
Because the amount of money they are taking for outpatient maybe spent only 2 months and everything is gone.
Mm-hmm.
Now you have exhausted your insurance, you have exhausted the NHIS,
Mm-hmm.
and then now it becomes a way of buying money for cash, buying the drugs cash.
Mm-hmm.
So I don't know whether the insurance and the NHIS would consider this post-transplant,
Mm-hmm.
but at least raise the amount they give for outpatient medication.
Right. Thank you for that, Asante sana Tabitha, for that. Very pertinent bits that Tabitha na raise, having insurance even for those post kidney transplant patients. Your thoughts on that, even as we get into the comments here on Facebook. Remember, a question of the day for you is, how do you take care of your kidneys? I'll be taking a look at them, but before that, I think it just reiterates to what we were talking about earlier, the insurance and what is catered for and what will be catered for on the social health insurance. Don't you agree?
Yes. So like I said earlier, SHA will extend the leeway to incorporate all these chronic disease management, including post-transplant cases. So it's just a bit of patience to have it, like organized so that it can be fully functional in the country. And it could help a lot of people like Tabitha. But in the meantime, we could also urge these pharmaceutical companies to maybe offer some discounts, so to say, so that people are not really burdened by, these medications, considering they have to take them all their lives to prevent their transplant rejection. So it's a cry to everyone in the medical field to help Kenya as a whole.
Right. A couple of comments here. I want to sell one is according to Kevin Lee. Kevin Lee, just so that you know, and you can also help us celebrate on the same, the law doesn't allow you to actually sell, but then you really have to donate. Kevin Amoy anasema, I went to the hospital and was told that I have a problem with my kidneys, hence the pain that I had been feeling. How can I take care of myself? So even as you answer on this, because we've touched on now this patient, but then you have someone who is the caretaker, who takes care of this, kidney patient. What do they need to know when it comes to taking care of them? I know we've touched on them somewhat, like the meals, the nutrition bit of it, but generally, what do they need to know as they're taking care of the relative friend who has any of these kidney diseases? Okay.
So if it's a patient on dialysis, one thing we really talk about is water limitation, because the kidneys are not able to excrete water by themselves. You have to limit water intake to 1 liter a day. This includes water that you take for medication or any liquids, tea, coffee, porridge. It all has to come down to 1 liter a day to prevent overload, because the kidneys can't remove it. And then reducing foods rich in potassium.
But briefly on the water, because we would be told that the body would really need a lot of water.
Yes.
So how if it is limited to 1 liter, how do you supplement the other liters so that at the end of the day, this person still has water in the body, but then it's limited to that 1 liter.
Okay, so it's a catch-22 situation because these patients, you really can't go above that 1 liter. If you do, the kidneys, what's left of the kidneys will not be able to remove the water. And what you will have is water filling up in the extracellular spaces, in the lungs, in the abdomen, and that will even cause complications, breathing problems, ascites. So if you really want to maybe supplement, you could go the fruit way. But also that we tend to reduce it.
Right. You'd mentioned about also the potassium, even as you also give us your final thoughts.
So potassium, you could do maybe citrus fruits, an orange here or there, maybe twice a day, thorn melons. Watermelon is a no because of the water intake, so maybe once a week or during dialysis days. Also, if you have any warning signs such as swelling of the face or hands or tingling sensations or confusion or upper abdominal pain, it's advisable that you rush to the nearest facility or to wherever the patient is on follow-up to have them looked at, because that could be a new complication arising. Yes.
Right. Even for your last words, just to reiterate, Kenya Renal Association telling us over 4 million people in the country have kidney diseases. This might go up even further come 2030.
Yeah.
In case someone hasn't understood what you've told us for the at least 1 hour so far, what can they take away from your last thoughts?
So, first of all is screening. If you could start screening at the age of 30 or earlier, that will be advisable. So this includes the kidney function test, urinalysis, full hemogram, and liver function tests. And especially for men, you could also incorporate prostate tests. You could do prostate ultrasounds or the blood test to check the levels, because this could rule out prostatic issues which cause obstructions, which lead to kidney failure. Then also lifestyle changes, exercises, reduction in red meat, limitation of alcohol, optimization of water in your diet. Then for patients who are kidney patients, limitation of water, adherence to medication and adherence to dialysis is very vital, as well as routine checkups with your nephrologist and monthly blood tests as well.
Right. A quick question for you, all the way from Tanzania. His name is Sebastian. Anasema, so first off, comment, kuna watu wana zaidi ya K2 utajuaje unayo zaidi? Or I think kidney mbili utajuaje unayo zaidi? If so, is it helpful? Using ginger, it's help. Then he also says, can you take a kid's kidney to adult? Is it fit? Majibu yake. Maybe just touching on it 30 seconds, alafu tukafunge.
Okay, so there's no evidence that suggests these ginger concoctions are beneficial or not, but it's healthy, it's natural, so there's no harm in that. Then in terms of the kidney, the child's kidney, you can't take it to an adult because adults require a lot of things going on. You have to support the heart, the liver, everything. So it would be suitable for an adult.
Right. Thank you very much, Joy.